all needed. And what it is, I'm in front of all these computers, and as in a war zone, Star Wars, and I have my fellow or nurse practitioner in the truck. They will assess the patient. I will look at the images, look at the patients, and start thrombolysis. And there's a video there, but that's fine for the sake of time. You can pass it. We did a meta-analysis in International Journal of Stroke with one of my students again. This is one of my fellows, and we looked at is it safe, it is effective or not, and you look at the trials that looked at the stroke ambulance versus standard of care, really to achieve in a mobile stroke clinic, in a systematic review, you achieve a better rate of life, a better rate of outcome with an odds of 1.57, and the same rate of mortality. So it is safe, it's more effective. And Jim Grata, in the best MSU, this is the best, I think the first randomized control trial published in the Journal of Medicine. He looked at using mobile stroke clinics versus traditional care, and what he proved that 33% in the MSU can be treated in the golden first hour versus 3%, and this is correlated well with outcome, where MSU shifted myocardial scale with the standard of care with an odds of 2.4, so there's 2.4 times to achieve the good intervention with the myocardial scale 0 to 2 compared with the traditional care. Now, moving to the last subject, telestroke worldwide. Telestroke will allow us to provide experience all over the world, and that's what we did in northern Syria, that's what we are doing in Somalia, that's we are planning in West Bank, Gaza, ask Allah to save them all, and let them pass this critical time. So, and that's what we will do everywhere, and that's what we would love to do in any area in the world. So, I will show you how telestroke works, and I have actually Dr. Ahmed. He's my CEO, who I rely on in building up the stroke program in northern Syria. Northern Syria is 5 to 6 million, mostly displaced people's refugee area. And we managed to build up a stroke program there with his help and the help of the team.
Assalamu alaikum. My name is Ahmed Mufak. I am working now in the stroke unit in North Syria. Everyone knows what's happened in our country, war and displacement, and this idea wasn't in our country, on our government. We start from 1 year, start with the clinic, routine clinic. Every day we have about 10 patients. We give him a paper for how modify risk factor and advise how analytics he must do every routine, and start at the CT scan after 2 months from beginning, and then we open the room observation for thrombolysis, capacity 6 beds, and we receive care from Canada to come and help us, and we add full team physiotherapy, and I said we haven't any idea about that in the past. We have trained paramedics to safe and fast help to bring patients as soon as fast to give them thrombolysis. And now we make training with cardiologists for endovascular therapy, and we have now angio suite to start, inshallah. And later we will train in Egypt with Dr. Osama and with Dr. Osman in Turkey. Every day we have a round with doctors from Canada and North America, and journal club per week, mortality per one per month, neuroconsultant, neurosurgery, and neuroradiology. have around doctor from Canada or North America to assist patients in room observation, and we can call him for urgent cases. This patient come to us with NIH Part 12. In 30 minutes, we give her KNK, and for recovery after 2 hours. Until now, we give about 20 DNK for patients for recovery.
So she came with a full right MCA syndrome, got the TNK, lovely woman, lovely elderly refugee. And that's me on the Zoom. Assessing
We called for urgent cases. We called Dr. Mahar and other friends from Canada and North America. They help us to build and give information about tranquilizers, and they give us order which they use in Alberta. We start from 1 year, but we start correct step, and as they said, better to arrive than never. Thank you very much.
So this is the logo for the programs, and I want to be sure, I don't know the cardiologist and special cardiologist, I want to be sure the logo has the heart and the brain and the dua in it. So this is the stroke program in Northern Syria, SAMS. SAMS is the NGO, Syrian American Medical Society, who support these programs all from the beginning. Now we are trying to build up, now all this area, like 5 to 6 years, we are trying to build up another program in far northeast. Now this is the northwest, and planning to map all these programs together for triaging. This is a picture of the team we started. We have to take it tilted because this picture was taken in February after the earthquake. So in support of the earthquake victims, we have to tilt ourselves and take this picture this way. Sorry about that. So my take-home message, it's all about team. Telestroke, it's all about team. Paramedic to emergency, emergency physicians, neuroradiologists. So you cannot claim victory by yourself. It's the team who works all together. Am I right? Telestroke must for equity and for best patient care. Stroke ambulance, think about it in the golden first hour. Now I can tell you south of here, when India started getting stroke ambulance, you can get stroke ambulance here. The reason you can get it quicker than what we get it in Ontario or something. The reason you can build a stroke ambulance in way cheap. Now stroke ambulance cost 2.5 million, 3 million, and probably you can build it up for 100,000 or 200,000, maximum $300,000. Telestroke without border, it's the message there. It will help us connect the east with west, build up our system, build up our regions. No, in any case. I always love this diagrams, and the paradigm of telestroke. We have to think about patients, care, and equity. Am I right? That's important. We have to think about our comfort. I'm not going to be able to run crazy back home. I want to enjoy my family and provide the best care. Patient comfort. Economy. It's good for the system, good for the community, good for the countries, and good for the physicians. And that's all of the difference too. With that, I will finish with acknowledging the University of Toronto, University of Alberta, where I did my work, and I came to know Anansa deeply. Trillium, the program, whom I'm honored to serve and help and lead them. There, MENA, SENO, great group. Thanks for Dr. Omer, Dr. Aisha, for everyone, Dr. Iqbal, everyone who makes this conference coming. And the Club Bus group, who I do research SAMS and also some NGOs. And this is the global team whom I have been loved to work with. This picture, we just took it the day before yesterday. We visit Peshawar, we visit Dr. Aisha Center. I'm so much impressed to see Dr. Aisha and Dr. Ayaz centers. They build up things on low resorts. And trust me, when you build it up with low resource, it exists, it persists, and then when you add the resource to it, you appreciate it more. With that, this is my fellows who got all awards all over the world. Everyone started his shop, his stroking it and shop like somewhere. And this is the team whom we are working in, Dr. Ahmed in northern Syria. I'm so much honored to mentor them. And he's all over the world. Everyone got awards, and I'm so much proud of them. I will finish with this statement. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. And that's what's the aim. So you need to come with a group of citizens who believe in goodness of their countries, of their lands, and inshallah that the things will work well. No matter how much resource you have or how much low resource you have. Don't worry about the resource. The resource will come after you have the good intentions. Thank you very much. This is an Alberta.
Well, by establishing such a wonderful telescope center in your province, I think this is a need for other people as well, that other people should also come forward. We request our fellows in Pakistan that they should also try to have such a wonderful center in the future, inshallah. Any question? We can have only one question.
Thank you, Dr. Mahar.
Thank you.
It was very wonderful, especially your efforts. I will request Dr. Cindy from Philippines. She would be talking about current state of thrombectomy in Philippines.